So these are two different classes of targeted agents. So the IPI-145, it's a PI3 kinase inhibitor. It's a little bit more inclusive compared to idelalisib, where idelalisib preferentially or selectively target PI3 kinase delta isoform. IPI-145 targets both delta and gamma, so it's give you more wider range of activity. It seemed like to have it's also good activity across different lymphoid malignancies, including indolent lymphomas, mantle cell lymphomas, CLL, and T-cell lymphomas, which goes beyond idelalisib because the delta itself is not a good target for T-cell lymphomas. It would be interesting to see where would this go, though, moving forward. There's a randomized trial in CLL. We'll see how it will go with IPI-145. But it adds, again, to the same class of agents that clearly have activity as a class, whether you hit the pathway, PI3 kinase pathway, at the PI3 kinase level, at the AKT or mTOR, there's clearly clinical activity in multiple lymphoid malignancies. But at the end of the day, again, the clinical trials will be the judge of where these agents will end up in the future. ABT-199, which is a BCL2 selective inhibitor, is a completely different class of drugs. It's of course a target BCL2, so it is, inhibits apoptosis inhibitors, therefore it induces cell death. It's still in phase 1 trial, but the data is very impressive even in a phase 1 trial, in both in CLL, mantle cell lymphoma, and even in large cell lymphoma, there's a good signal for ABT. So although it's early to call, I think it's going to be one active agent that we should watch very closely.